My name is Ruben Gobezie. I'm the director of the Cleveland Shoulder Institute. And I'm going to talk to you now about a topic that I would title the most common shoulder problem no one's heard about. What am I saying? Well, of course, I'm here to share and try to educate you about shoulder disorders. And one of the most common, in fact, the most common shoulder disorder I see in the office is not rotator cuff tears or arthritis. It is biceps tendon problems. They are biceps tendon problems. So I always say, well, what does that mean? People say, well, what do you mean a biceps tendon problem? Here's what I mean. And if you have a shoulder problem, chances are, as I go through the description of what it means to have this, you may relate, okay? So the biceps tendon, most people think of the biceps curl in the gym, the muscle exercise where you do this. And the biceps muscle is, in fact, that muscle, the one that you're exercising and that you're familiar with. But interestingly, the biceps tendon is not the muscle. The muscle's here, but what attaches that muscle is a rope-like cord that runs up the front of the shoulder, called the biceps tendon. And many people being unable to curl a dumbbell. They can do that. If they keep their elbow here, they can do this all day long. What people complain about with biceps tendon problems, and trust me when I tell you, it's a very common problem, the most common problem I see, is that they have pain down the side of their arm when they rotate their arm. Even if they don't describe it to me like that, this is what they say. They say they can have a difficult time, meaning a painful time, undoing or putting an arm into a coat, tucking their pants in, reaching behind them in the back seat of a car, pulling a t-shirt off like this. And they say if they do that, they get a sharp pain down the side of their arm. A lot of people will say, oh, I have a rotator cuff tear, or oh, I have this, arthritis, or so on, and thinking that it's one of the things they've heard about. And oftentimes, when they see me, I'll tell them this, and they've never heard of it. It's a biceps tendon problem. And I say problem because biceps tendon problems really come in three flavors. One is you can have a tendonitis, the most common thing, meaning when I say tendonitis, I tell people that what I'm really saying is that tendonitis is an inflammation of the tendon that resolves by itself, meaning gets better, with time. It can take up to 6 months or even a year, but it gets better. So when I say tendonitis, I mean that the person's going to get better, that they have those same symptoms, but it's not going to stay that way or get worse. The second way a biceps problem can manifest or present is as a tear. Those problems, when I say you have a biceps tendon tear, again, a very similar complaint, oftentimes a little bit more acute, not just having a problem getting into the coat jacket, but I can't do it. I've got to put this one first. But the same difference. That one I'm telling you, when I say tear, is it's not going to get better. In fact, those tend to get worse. That same type of pain tends to become more acute. And so you cannot begin to pull. You're taking t-shirts off differently. You're putting coats on hand first because you can't bring your arm back. You cannot get in the back seat of the car. You cannot do your bra. You cannot pull a t-shirt. So those are that's the other way it can present. The third way, and a very common way at that this problem can present is as biceps instability. What do I mean? A lot of people will have these similar symptoms, but also complain of a clicking or popping or catching or snapping in the shoulder as they move their arm around. That phenomenon occurs because the biceps tendon dislocates out of a little groove it sits in the arm normally. And instead of sliding in the arm as you move your arm, it dislocates in and out of that. And that dislocation is painful, and it causes a type of clicking or catching or popping that the person will talk about. As it happens over and over again, the tendon becomes inflamed because it's not used to dislocating out of the groove, it's used to sliding in the groove. And when it becomes inflamed, you get a tendonitis with a clicking. And that's basically what it is. Each of those problems have a different natural history, meaning what happens to that person. Remember I told you the tendonitis gets better, the tear doesn't get better, and the clicking, dislocating, doesn't get better either. It's usually because of a ligament tear. So how I treat those persons, each of them differs. Here's the other interesting thing about the problem no one's ever heard about that's so common. The other interesting thing about it is you can't really pick up and differentiate those three different problems of the biceps that I described to you, the tear, the tendonitis, and the dislocations. you can't really differentiate them on an MRI. So people often want an MRI scan to try to understand, well, doc, okay, you've explained this to me. Which one do I have? Usually, you cannot see them on an MRI scan. MRI scans only detect 40% of biceps tears, and they don't really pick up much on the tendonitis or on the instability. So it's really a diagnosis of exclusion. Essentially, I treat everybody as if they have a tendonitis. As I say in the office, the glass is half full until it's not. And I recommend typically a cortisone injection. I use ultrasound guidance, and really so I can see exactly where I'm putting that needle and give the cortisone shot. And if it's a tendonitis, it'll resolve the problem. The person will have an anti-inflammatory, which is what a steroid injection is, and essentially resolve the itis of the tendonitis, meaning the inflammation. It can come back, even with the tendonitis, because remember I told you it can take up to a year to resolve a tendonitis, but usually it's very effective enough to make the person happy. On the other hand, if it's a tear, that same person I told they may have a tendonitis has a recurrence of their symptoms very shortly after the injection. And the same can be said about the person with a dislocation. So as you can see, there are situations where the cortisone shot will resolve it completely, which is a tendonitis, and then there are situations where the cortisone shot may or may not resolve it. Where if it's torn, it won't resolve it, or if it's unstable, it won't resolve it. Here's the take home. The beautiful part about a biceps problem, as annoying as it may be for the person, is that you don't have to treat it unless you have to treat it. Meaning, as long as you can tolerate it, it's not a problem to leave it alone. Nothing bad will happen by neglecting it, other than it will be the pain when you rotate your arm that we described earlier. So who is it that gets treatment of the biceps beyond a cortisone shot? Well, clearly the people who don't get better and have a need for rotational motion. So, for example, a tennis player, a baseball player, a golfer, if it's the non-dominant shoulder. So, for example, a right-handed golfer with a left shoulder with biceps pain will be very painful. Interestingly, a right shoulder with a right-handed golfer won't affect the golf swing at all. So, those people on assembly lines who I've taken care of who are constantly having to rotate their arm. In other words, if it's an activity that the person desires to do and can't do, or has to do and can't do, those are the people who ultimately end up having a surgical repair of the biceps, which the good news is, again, not very onerous. It's a very quick surgery. It takes me between 5 and 7 minutes to do. And essentially, they can get over it relatively easily, and they can use the arm within the first week for what we call activities of daily living, and take the arm out of the sling right away. It's an outpatient procedure, and within 3 to 6 weeks, most people can move their arm pretty well. Within 3 months, they're better enough they don't need to see me anymore. They can pretty much use it and use common sense, and they'll get better over the course of the next ensuing 3 to 6 months and to full recovery. So the good news is it's a problem that's very common. As I said, it's a problem, the most common problem no one's heard of, and it's a problem that has a very nice outcome, even if it ends up in surgery. So I thought you'd enjoy that, and and you probably can relate to it if you've had a shoulder problem. Thank you.